Thank you for taking the My Livingskin app training. In this tutorial, you will learn kit setup and usage, tips and guidelines for image taking, and impression guidelines. If after the presentation you have additional questions or comments, please contact your local customer support representative. When your kit arrives, it will come in a large cardboard box. Inside the box is a gray Explorer case, an impression kit, and an order acknowledgement. Inside your gray Explorer case, you'll receive an OttLight with a spare bulb and a diffuser attached. Inside the lid of the gray case is a white and gray plate for your background. On top of the gray case within the box should be a sleeve including a color panel. There's also an iPad Air with a charger. Inside your iPad Air is a folded sheet of paper with your order number reference. Also included is a microfiber cleaning cloth for the iPad screen. Inside your impression kit, you'll receive impression material. The quantity is specific on the order in which was placed. You will also receive casting materials. You should receive about 2 to 4 impression mats, 4 to 6 mixing sticks, 2 pairs of gloves, an impression tub opener, disposable apron, 2 wrist and/or ankle bands depending on the order in which was placed, a tube of Vaseline, a quick reference guide for the impression taking that you are doing, an impression bag with label, and a return label for North American orders only. Upon receipt of this package, we do ask that you place the contents in a refrigerator at least 24 hours prior to the appointment. Your impression material should be cold. On the day of the appointment, we want the patient to come in and get to a normal resting color. To allow this to occur, we ask that you go over a few questions prior to using the application. You want a piece of paper handy to fill out any answers at this time to later be added to the app. First, go over physical presentation. Go over pain, sensitivity, range of motion, and contractures. If there is any areas of pain, like an aroma, we may be able to accommodate this in the sculpt and/or fit of the prostheses. For areas where there is a contracture, we may want to discuss special design requirements to allow for the contracted digits to pass through the prostheses. Also go over daily activities and special usage, like a typing digit. We may want to go over a goniometer reading for special flexion requirements. Also go over the expectations of the prostheses. Knowing what your patient's going to do with the device may help us in the design later on. Please remember to record all this information so that it may be added to the comments section of the application. Various things do affect the skin tone of your patient. So while you're going over the various things about the pain, sensitivity, and skin color fluctuations, we do ask that their hands be in their lap so that they may get to a normal resting color, and for lower limb clients, that their shoes and socks are removed. We do discuss that certain things affect the skin tone of a patient, like emotions, temperature, movement of the limb, and the positioning of their limb. Smoking will also affect the color of a patient's skin tone as well as season to season. When taking the images, you want the patient to be calm, at room temperature, and have rested for at least 30 minutes. When seated for the app, you want them seated with their arms at table height. You don't want to be standing or reaching the arm out onto a high elevated table. The patient should also be cigarette-free for at least 30 minutes. You want to discuss color with the patient as well to see if they have just come back from vacation, or if they're planning on going on vacation prior to delivery. This may affect the skin tone when it is being fit at later stages. When setting up your room to use the My Livingskin app process, please ensure you have controllable lighting. The overhead lighting will need to be turned off when you begin the order. If your room has a window, please close the blinds. The only light source should be the OttLight. The OttLight will have the diffuser attached and fully open. Place the OttLight to the left-hand side. The center should be the white plate, and the gray plate should interlock and be placed on the right. When leaning over with your iPad, ensure that the setup appears like the image here. where the light is on the left, the white is in the center, and the gray is on the right. The patient will be seated to the right-hand side. Lay the color panel on the gray plate. The edge of the color panel should meet up where the gray and the white plates intersect. The hand of the patient or the foot will lay in the free open space in between the colors. When your setup is complete and you're ready to begin the order, power on your iPad. When powered on, you should have two icons, the Settings and the My Livingskin app. Go to Settings and connect to your local Wi-Fi. If you are in North America and Wi-Fi is not available, you may also use the cellular data. For connection problems or issues, please contact your local representatives to walk you through the process. The iPad does need to connect somehow to upload images to the cloud. When you're ready to begin, please hit the My Livingskin app. 3 blue bubbles will appear. They begin order for all brand new orders, the continue order button, to be used if you need to minimize the application for any reason and continue on with the process, or the review order button. The review order button allows you to see images that you have already submitted or completed. This is very helpful when asked to take multiple rounds and review to see the best overall color. If you would like to practice the application prior to your patient's arrival, you may utilize the test feature. To do so, enter 5 number 9s as your order number and test or demo as your patient identifier. When you hit Begin Order, you will be prompted to choose the product in which you are fitting on your patient. You may opt to choose the Livingskin Match, which is for Ilim glove options only, or Livingskin for passive options only. Once you have entered the product in which you are fitting, you will be asked to enter your order number and patient identifier. The order number is placed on a folded sheet of paper inside your iPad for North American orders. For orders outside of North America, your local representatives would have contacted you with the specific number. Please do not make up your own numbers. Doing so may result in lost images or erased data. The patient identifier will be entered as the patient name or the identifier in which your practice utilizes. Once complete, hit the Continue button. When you have entered your patient's information, you will then be asked to choose a device type. Device types range from fingers and hands to upper arms to toes and feet. For specific requests, such as changing a device that could be a half finger to a full finger, please contact your local representative to discuss further. For patients who are seeking devices like total hands or wrist articulations, you may need to contact your representatives as some additional information may be required. When choosing the device type for an Ilim skin match order, you will be asked if you would like an Ilim hand only or an Ilim transradial. The Ilim hand only is for a glove only option that transitions just beyond the wrist. The Ilim transradial goes up to the elbow and is in 2 pieces. The forearm section is custom carved to the socket. A definitive socket is required in North America to be sent into fabrication for copying. For rest of world orders, a cast of the socket is also required. If you have any questions on these processes or your definitive socket, please contact customer support. At this time, the application will prompt you for slides discussing the setup and the patient's limb placement. Follow the instructions on each slide. Hit the Next button for the next question or directions. Once the application instructions have completed, the iPad camera will power on. At the top of the slide, it will tell you exactly which images to capture and at what time. There is also a small icon in the upper right corner of a limb and its placement as the images progress through the application. To see example images, please follow through the training to see examples of limb placement. When capturing an image, the screen should appear like the one below. The patient's limb should be about 1.5 inches from the gray and the white plate intersect or just below the color panel. On the screen of the iPad, you want to ensure that just the color panel and patient limb is in view. You also will require a slight amount of white to the left-hand side, just like the one on the screen here, that is incorporating just a bit of the white tab. On the camera itself, you will see that there are two buttons, a camera level and a camera icon. The camera level will sometimes be red and floats around the screen. You want to tilt your camera both right, left, up, and down to make sure that the icon turns green. When the icon is green, the camera icon will go from gray to black. If for any reason your camera remains gray and inactive, there is something going on with the positioning of your setup. So please ensure that overhead lighting is off, the light is on the left, the patient is on the right. If you do experience continued issues with the camera icon remaining gray, then please contact customer support for troubleshooting. After you've taken a photo, you will be asked to retake the images or use the images. When reviewing the photo, it is not color calibrated yet at this time, therefore the color may not be accurate, so we are actually looking to see if the image is blurry or lit inappropriately. If the photo appears blurry, we do ask that you hit the retake button. We're also looking to see if the image is overly lit. Sometimes if the patient gets too close or there is inconsistency of the position of the limb, it may create a shiny bright area on the hand or the foot. So please reposition the patient so the images appear like the ones below. Here we have examples of ideal placement of the limb. For fingers, hands, and larger upper limb cases, the photos should appear like the ones here on the slide. For patients seeking wrist articulations, transradials, or transhumerals, forearm images may also be requested. You will also need to capture the same images for the affected side limb. In the image here of the thumb, we are showing you the side of the hand. Thumbnail requests are not necessarily for the thumb of the patient, but rather the dorsal and palm color transition that can only be seen when the side of the hand is in view. So please ensure that your images look like the one here in the shape of a C. You also will notice on the dorsum of the sound side and the palm of the sound side that we have an abundance of the wrist. This is very important to ensure proper color and to also see areas where there may be hair needed or the transition of veins down the wrist. The next following slides are pointers and tips of the process. When a patient arrives, we do ask that the limb is clean, free of dirt and debris if at all possible. We also ask that they present with the skin tone that they prefer on the prostheses, for example, no fake tan or sunburn. We also ask that when taking the images that the patient does not have nail polish or varnish, temporary tattoos, band-aids, bandages, or excessive jewelry that may inhibit us from viewing the skin tone. Patients that do arrive with painted nails that are unable to remove the polish and or fake nail are asked to be aware that we will make up what we see underneath. Therefore, tips, colors, and lunulas will be at the discretion of our technician. This image here shows inappropriate framing with the iPad. Too much white plate in view will affect the overall skin tone of the patient and create very bright lit images. We also ask that no floor, desk, or walls are in view as well, as these surrounding colors may affect the patient's skin tone. The images below are reviewing hand placement. We prefer that all fingertips and the ends of toes are placed 1.5 inches from where the white and the gray plates intersect or just below the color panel. The image to the left has inappropriate hand placement and is obstructing the color panel and getting too close to the light. The image on the right has appropriate hand placement. The images below are also discussing hand placement. It is very important that the limb remains nice and flat. You can see to the left that just a slight curvature of the fingers creates a very heavy shadow. This does not allow our artist to view the color of the patient's limb, therefore we are missing important and vital information. If your patient has a contracture in their limb that is causing the curvature, then please let us know so that we may find a workaround to find the colors that we require. The image to the right shows appropriate hand placement with the limb laying nice and flat. For lower limb orders, you will repeat the setup for upper limb, but place the kit setup on the floor. A yoga mat is provided for the patient's comfort and will be placed under the gray plate and extended outwards. The patient will be seated on their bottom with their knees bent and their leg extended forward. For lateral and medial views, you'll do the same and tilt the leg from left to right. For plantar images, we ask that the patient be on their knees and leaning forward onto a chair for comfort. The foot will be extended behind them and placed on the gray plate. Wrinkling of the plantar surface is okay. Once you have completed the photo process, the fabrication pages will prompt. The nail information will be first. You will be asked if you would like to use the images for the nails or use a custom option. If the patient is presenting in a manner in which they would like the prostheses to look, then by all means use the Use Image button. We will copy what we see in the photos and what we see on the casts. For patients presenting in a different manner that would like longer tips or shorter tips or complete design changes, like going from a very short natural tip to a long French tip, then please use the custom option. For the custom nail page, you will be given the options to choose the nail shape, include lunulas, and adjust the nail length. For the lunula section, you must hit yes or no to proceed forward. For the nail lengths, there must be a numerical value added, whether or not you're changing the nail length or not, so please put not applicable or adjust the lengths accordingly. Then hit the continue button. For the nail shape, you were only given icons. This slide here further explains what each icon stands for. The very first icon is a square or French tipped nail. This is for nails that are manicured in appearance or for feet and toes where you're looking for a more boxy shape. The next one is for rounded nails. This is tapered in the corners and longer in the center. The third one in is a natural tip. This is our most common option and has the same amount of white length all the way across the tip. The last one is a pointed nail, which is a very exaggerated round nail with a very pointy center. This slide is for fabrication questions. There's a free text section for comments. You'll indicate here things that you discussed earlier on with your patient, for example, special trim line or design, or certain degrees of flexion that you would like in the digits. Please indicate a degree of flexion here using a goniometer. Below the comments is for dominant dorsal and dominant palm color selections. These colors are taken from the color panel that was supplied. If you feel the patient is more than one tone for each individual section, please indicate those extra colors in the comments section. These open fields for color will only accept one number. Below your color options is selections for dermahair, freckles, and veins. Dermahair is an extra cost. If this is indicated as yes, we will call to discuss further. Freckles and veins are simple yes or no answers and do not carry any additional fees. If your patient was a partial hand, you may see something like thumb stabilizer pop up at the bottom of your slide. Please select yes or no. These options are only for patients with thumb loss, at least at the MP joint or lower. We do recommend that these individuals have at least an intact index or middle finger, so they may oppose against the thumb stabilizer. If you have questions on any of these components or any of the selections in the open fields, please contact customer support to walk you through the process. If your patient is seeking a lower limb prosthesis, like a partial foot or a full foot, you will be asked about the trim line. We offer boot cuts for more stability and slipper cuts for easier donning and doffing. We do advise that patients with heel height discrepancies do not go with a slipper cut due to the loss of suction possibility. When seeking an Livingskin matched prostheses, your fabrication page will differ slightly than our passive options. You will be asked first about the nails, whether you want silicone nails or acrylic nails. Silicone nails are softer to the touch and more durable. Acrylic nails are hard to the touch and are paintable with non-acetone remover. You'll also be asked about your trim line. Trim lines can go to the brim of the socket or extend beyond. If you wish to extend beyond the socket, we ask that you create a measurement of the length and the circumference at that length. You will also be asked if you would like a hole for your charger or not. Hit yes or no. This will be a small puncture through the skin to allow the port to connect. For larger orders, like wristless articulations, transradials, and transhumorals, you may be asked for additional information. For wrist articulation, you will be asked for a prayer position. This image is taken with the elbows planted on a table and the hand in a prayer position in front of the patient's face. This allows us to see how the affected limb lies against the sound limb to get an appropriate length. For patients with sockets, you will be asked to take photos of the patient standing with the socket donned. This will be taken from the front, back, and side. You will also be asked to take socket registration marks. This will be done with a black Sharpie mark on the socket. This will be your fixed point of reference. Measure from this fixed point of reference to the areas indicated, like the elbow, the styloid, and the thumb tip. You will also be asked to take circumference measurements of the wrist, mid-forearm, and upper arm. When doing a socket, we do request that all sockets are endoskeletal and have a pylon attached. Pylons must be metal. They cannot be made of plastic, wood, or any other material. Each larger device will have a window for the measurements. On a wrist articulation order, you will be asked to take a measurement from the most distal point of the affected limb to the sound thumb tip. This also helps us establish the overall length, as we'd get from the image of the prayer position. This will work in tandem with that information, as well as circumference measurements of the sound anatomy. For the transradial transhumeral worksheet, you will fill in the numbers accordingly against the fixed point of reference. On larger transradial transhumeral pieces, you'll be asked about the trim line. If you're going beyond the brim of the socket, we do ask, like in the ILM requests, that you measure the length and the circumference at that length where you want to go beyond the brim. You may also include wrist units, like pronation, supination, and flexion extension. If you hit yes and the component is not included, you may purchase this from OSER. Otherwise, you may please ship your own components and we will install them for you. Here we have a few pointers for our larger limb devices. The prosthetist must submit an appropriate socket for their patient, ensuring good suspension, fit, and pylon alignment. We do prefer an endoskeletal design with the pylon attached. The fabrication team will not secure pylons to incomplete sockets. Sockets may be submitted with a passive hand attached to give us alignment and pronation supination. These hands will then be removed and returned with the definitive device as they are not needed. Wrist units may be provided by the prosthetist and or purchased from OSER. A reference point must be marked on the socket in black Sharpie. If you're concerned on the mark, please cover it with tape. The length circumferences must all be submitted on the My Livingskin app, as well as the patient wearing the socket. As a reminder, all pylons must be metal. Pylons made of laminate, plastic, or wood will not be accepted. When all the fabrication details have been completed, you will then be asked to review your photos. Use your finger to swipe on the screen to see all the images captured. We ask that you close your OttLight while reviewing and turn your overhead lights back on. Lay the iPad next to the patient's limb to ensure an optimal color match. Once the patient is satisfied with the images you have taken, sign on the screen and then hit Approve. Once you hit Approve, hit Submit Order. This will then send your images through to the cloud. After you hit the Submit Order button, a second window will appear showing the submission of your order through to the cloud. Once your order is submitted successfully, the images are now going to customer support for review. We ask that you not set up your station yet for impression taking. Please await approval on your images. You may be asked to take a secondary round, and we do not want the patient to already undergo the impression taking process, as this does create a red and oily appearance to the skin due to the Vaseline and the suction of the impression process. If your images are accepted, you will receive a phone call from customer support to discuss further. If you cannot be reached by phone and the images are accepted, you will receive the email response below. For images that are not approved, you will be contacted via phone, email, or text to discuss further. If you do receive an email, it will look like the one below, discussing what went wrong with the photos and how to correct the problem. If asked to take a second set of images, you can only use your order number one time. Therefore, you will need to put a -1 at the end of your order number. For example, if your order was 12345, you will then put 12345-1. Images are reviewed during normal business hours of 7 a.m. to 4:30 p.m. Eastern Standard Time. We do offer after-hours appointments on a pre-scheduled basis. We will review images up till 6:30 p.m. Eastern Standard. Images sent in after hours with no prior notice will be reviewed the next morning. If you have received word from customer support that your images are approved, you may now set up your station for the impression taking process. Remove all the contents from your impression kit. Also remove your material from the fridge now that it has been chilled for at least 24 hours. Here we have links to our impression videos. These links are installed within your iPad under the Help button if you need to review these at a later time. Also included with this training are links via email to the hand, finger, and foot impression videos for additional support if needed. Now it is time to prepare your patient for the casting process. Add a small amount of Vaseline to the sound and affected limbs. All casts will be bilateral, with the exception of devices that require sockets. Use a paper towel to remove any excess amount of Vaseline that has accumulated on the fingernails and/or limb. Apply additional Vaseline to areas where there is a lot of hair and mat the hair down in the direction of growth. For patients wearing jewelry, we ask that they remove it if at all possible. If this cannot be removed, we suggest placing tape and/or a Band-Aid over the jewelry to prevent any loose stones from coming loose. Now that you have applied a mold release, you will want to apply your bands. This is only needed on devices that are seeking passive hands, transradials, transhumorals, wrist articulations, and foot prostheses. This is not needed for fingers and toes. Place the bands at least 2 inches proximal to the styloid or 2 inches proximal to the ankle bone. When you are ready, remove the lids of the impression material. You want to mix it thoroughly, scraping the sides and bottom as the material may have settled. When adding the activator, use the entire bottle if the material has been refrigerated. If you are using room temperature mixtures, then please use only half the activator as it will have a very rapid cure. When starting the material, pour it from the area in which you want it to stop. So therefore, pour at the wrist and work your way down to the fingertips. You'll want to rotate the hand from side to side, dorsal palm, applying as much mixture as you can and scooping up from the desk and reapplying. At this time, you want the fingers to be slightly splayed so that material flows between them. As you're rotating from side to side, the material will start to get gummy and you'll want the hand in the position that you desire for the ultimate prostheses. So either in a relaxed position for a standard device or in a flex position for something used for typing. Use the secondary tub to fill in voids and gaps on a passive hand order. Again, rotate from side to side, dorsal palm, filling in areas of voids and ensuring you don't have thin spots or holes. When applying the second tub, ensure you have no voids, gaps, or holes, and that the hand stays in the relaxed position. At this time, you want to ensure that your thumb is in a rotated position so it's in opposition with the index. This is the ideal pose for passive hands, transradials, and transhumerals. When applying material for a finger order, you can start your pour at mid-palm rather than incorporating the wrist. You'll do the same as you would for a hand by having the fingers slightly splayed, pouring the material over down to the tips, and ensuring proper coverage. You'll rotate from palm to dorsal to ensure you get coverage of all of the digits. All digits should be included on a finger cast, the index, middle, ring, and pinky. When completed, have the patient put the hand to the side in their desired pose and let it cure fully. You may then start the second cast so that you ensure the first cast has a proper cure. For lower limb casts, we ask that you tape your blue mat down to the floor. It's helpful to make a silhouette of the shape of the foot so you know exactly where the material needs to go. We suggest doing this with a black Sharpie. You'll then mix up 1 tub of silicone using the activator and creating a puddle on the floor. Let the puddle cure slightly so that it's no longer drippy and just tacky. Have the patient seated with their leg at a 90-degree angle and place the foot down into the puddle. You want to push slightly in a semi-weight-bearing position, but not all the way down to the floor. As this cures, mix up tub number 2 and tub number 3 and apply the activator. Mix these thoroughly and work them over the dorsum of the foot, working your way around the heel and up the ankle. You will need that third tub around the ankle and the heel so that you don't have very thin spots. Once the impressions are cured and you've completed your bilateral casts where applicable, it is now time to remove them. Run your finger along the edge of the impression to help break the suction. For larger pieces like a foot or a hand, do an irregular tear down the side of the pinky or the back of the heel. Do not cut these with scissors. An irregular tear is preferred. You will not need to tear a finger impression as these are rather short. Have the patient wiggle their fingers and/or toes to help release the suction. You will then grab onto the impression and gently pull away. When the impressions are removed, we ask that you then box them up for return. Please place tissue and/or paper towels inside hand impressions and feet to ensure they do not collapse in transit. Please place them back into the bags provided with the labels of the patient's name. Then place everything back into the impression box. This will ensure that the My Livingskin box and the patient's impressions do not get crushed. Please use the North American return labels as needed or contact Oser Livingskin for return of your kit contents. Upon receipt of your impressions, they will be reviewed for proper pose and coverage. If they are approved, you will then receive your expected ship date. If for any reason the impressions are rejected, you will receive in writing what had gone wrong and instructions on how to correct the problem. A new impression kit will be dispatched that afternoon. If you have any questions or concerns regarding the process, please contact your local OSER representative and they will walk you through the process. Thank you for taking the My Livingskin application tutorial. You will now receive a quiz of 10 questions. For those of you completing the quiz of at 80% or higher, you will receive Livingskin certification. For customers in North America, completion of this quiz will also earn you 0.5 CEU credits for ABC certified providers. If you have any questions on receiving your certification or your credits, please contact your local OSER representative.